And so that's a different kind of view of how this stuff works. Again, we are talking about perfectly biologically correct responses. And what we have done in the world of mental health, and to some extent in education, is that we have negatively assigned value to normal, predictable human responses. In a sense, what we're saying, it is not okay to be a human being. And since we have no choice in being one, we're putting people in this very, very uncomfortable place quite often when we're trying to help them, is that we are demanding that they not be human and be human at the same time. And that kind of distress, that kind of demand, just further dysregulates quite often their system. So what should you see? What is absolutely correct? When the body perceives some kind of need to adapt and it moves into an aroused state, one of the basic things that should happen is what we call a limbic shift, and that's a movement from a balanced state into a dominance by the sympathetic nervous system, and that shift is going to start at the diaphragm and just blow everything above the diaphragm into a state of arousal. Or if you want to think of it in a different way, it's an excitatory system. And once the excitatory system begins, you're going to notice changes in the diaphragm muscles. You're going to notice changes in breathing, breath rate, heart rate, blood flow. You're going to notice cold hands, cold feet. Some people get headaches. These are completely predictable responses when the sympathetic system churns into activity. I think almost everybody has had that happen many, many times to them. That's not the problem. It's just as designed. The question we don't ask quite often, which we probably should ask, is what is happening to emotions, thinking, and behavior as the sympathetic system moves into a state of arousal? As this body shifts, as it shifts because the metabolism changes. It's shifting because the metabolism changes. Why is it shifting? Is it doing it because people are difficult and problematic? No, it's shifting because their metabolism shifts. And these are the natural kinds of things you should see. When the sympathetic system, or that hot system, or the excitatory system, or the limbic system, whatever you want to call it, when it shifts into a state of dominance, then our view of things becomes different. We are all about this moment in time. Everything's immediate. There's no future. It's impulsive. It's irrational. It's illogical. There is no self-reflection. There is no self-evaluation. That isn't wrong. That's absolutely correct behavior when the system is churned up. So let me give you some examples. Because we tend to think of this, oh, this is bad. This only happens when something horrible happens. No, this happens whenever the body moves into that excitatory state. So I don't know how many of you have been behind the wheel of a go-kart or behind a bumper or on a bumper boat, but when you're in the midst of being behind the wheel of a go-kart and you're really having a good time, think about it. Are you focused on the moment? Are you thinking about the future? Are you making logical, reasonable choices? Are you reflecting on yourself? Are you reflecting on your life choices? Or are you just having fun behind the wheel of the go-kart? Would this be a good time for somebody to want to speak with you about you planning for your retirement or your financial planning? Probably not. Not because you aren't interested in those things, but because you are not in the right state to have that discussion. What about a sport? A lot of people like sports. How many of you have played baseball or soccer? Do you want a team member to move into a state of self-reflection and self-evaluation in the middle of a game? Can you imagine the effect of having a first baseman that goes, I'm wondering if I'm being a good person. Am I making good decisions in my life? Am I living a life of integrity? Do you want them having that discussion in the midst of this game? Probably not. You want them to be immediate. You want them to be reactive. You want them to be focused on what's going on. and that is the nature of this system. Now, another way that this also comes back to haunt us is in the wonderfully intelligent things we do when we're having a good time. In the area where I live, here in the Phoenix metropolitan area, a while back we had some kids jumping off the roof and filming it on their phones as they were jumping off into the pool. And a number of them had made it into the pool just fine, big laughs, ha ha ha, isn't this great fun? However, one missed, and her miss landed her in a wheelchair for a while because she broke her legs. Now, how many of us have done things like that when we have just been in the moment and we haven't thought about the outcome, we haven't thought about what should happen, we just go for it because we're in a moment of arousal. Now, what people on the outside always say, well, why didn't you think about that before you did it? And the answer is really easy. Now, nobody wants to hear the answer, but the answer is easy. Because I was in my sympathetic nervous system, I couldn't think about that. Not that I didn't want to think about it, I just couldn't think about it. I'm not in the right state physiologically to have a self-reflective conversation with myself. Now, how about disagreements, conflicts, where we don't get along with somebody very well? How many of us have had those moments? If you think about, I'm sure you've had at least one in the last year. If you've had one serious disagreement with a loved one, think back to that time. Weren't you in this state? Wasn't it about this moment in time? You weren't thinking about the future. It was impulsive. It wasn't all it wasn't all rational and logical. Did you really start and think about how great this was going to be for your relationship 5, 6, 7 years down the road? Or were you just in it and you wanted your own way and you wanted it right now? That's pretty much how this works. You're not a bad person. Sometimes the consequences of being sympathetic system dominant are unfortunate. However, they're not wrong. And what we have done, particularly in the world of education and mental health, is we've made it wrong to be in this state. And we demand that the most dysregulated people, the people that are in the most disarray in this system, if you wanted to put it on a scale, of being 0 at no arousal at all, and they're 10, and we want somebody that's at an 8 or 9 or 10 to stop what's annoying us or what's getting in there or what is creating problems for them. But that is not the problem. It is that their body is in a state of arousal, and the behavior and the way they are thinking and emoting is exactly correct with that state. The answer is not to focus on the behavior, not to focus on the emotion, not to focus on the thinking. It is, how do we get this body out of that state of arousal? How do we calm that body down? Because think of your own selves when you've been in this state of conflict with a loved one, and you've said things that are dark and ugly and hurtful, or you've done things that you really, or really wished you hadn't done. When you are out of that state at some later point, you didn't do those things anymore. You weren't thinking that way anymore. You weren't saying or doing those things anymore. Why? Because you are no longer in the state driven by a physiology to behave in predictable ways. You are back into a more balanced state, and you could behave differently. So I have a simple metaphor for this, and I hope it's useful for people. The simple metaphor is, and I'm going to use the Marvel Comics, the difference between Bruce Banner and the Hulk. We're often wanting Bruce Banner behavior out of the Hulk. And the reality is, before we can get Bruce Banner behaviors, we have to get the Hulk calmed down. You cannot expect planning. You cannot expect self-reflection, self-evaluation out of that limbic aroused system or the Hulk system. You can only have access to those things when someone is in Bruce Banner mode. Now, If those of you that are familiar with the Marvel comics, you are not going to get the Hulk to be less Hulk-like by confronting him, by criticizing him, by blaming him, by putting any kind of demands on him, because that's just going to make more and more Hulk behavior emerge. How do we calm them down? You have to get them in a relaxed state and get it if you want to have access to the genius. We often are trying to apply behavior management in classrooms. We're trying to apply behavior management in mental health settings, in parenting, in therapy. We're trying to get people to think logically. We're, do cognitive work, cognitive behavior therapy types of things. We have cognitive, programs in school to help them think through what they're doing. However, if they don't have access to Bruce Banner, none of those things are going to work very well. As long as the person's body is churned up, as long as that sympathetic system is dominant, as long as this excitatory system is still in charge, you cannot get people to think differently than what this system demands they think. It can't get them to behave differently than that excitatory system is designed to behave. And you certainly can't get them to emote differently than this system is designed to emote. That is, and putting the demand that they not be the way that they are just adds more arousal fuel to their already enraged fire. So the question then becomes, well, if it's not a big bad event, how does trauma get created? Or another way of looking at this is, how does the body get pushed to the point that it has to adapt or mitigate? And so I want to talk a little bit about that and lay some of this groundwork out for you so that it can make some sense. Every one of us have a certain range of tolerance. Depending on who you read, they may call it a window of tolerance. Some people call it a window of resilience. It doesn't really matter. We're going to say you have a certain range. And that's great. What they forget is that there is something that is the first and most powerful influence of the range of tolerance is not necessarily what people think it is. It is the state of the body at this moment in time. So anybody that has probably had a newborn in their house has, after 3 or 4 days, realized they're not sleeping like they used to sleep. They may be tired. And one of the natural consequences of having the body being affected is that they may not be as warm or patient as they normally are. Or how many of you have had a really bad headache? Are you less kind to those around you? Do you demand more from other people when you don't feel well? How many of you that have had bad colds or a flu have been snappish and irritable? Now, that isn't because of some character issue that you have. It is because your ability to tolerate anything is affected by the state of the body. So one of the things that must be paid attention to is what's going on with this body and how is that body responding. And so the range of tolerance for each of us is going to be influenced by a number of things. How much adversity we have in our history, how much adversity we're having currently, but it also is on what's the state of the body at the moment. So with that, what's really happening? So we talked about this being a metabolic change. When people are experiencing reactions to the environment, the body responds by releasing different chemicals into the system. And I call it the fiery cocktail. It's made up of a bunch of things, about 30 items. So I'm not going to name them all, but certainly cortisol is a fairly popular one, adrenaline, noradrenaline, catecholamine. Those are very popular, well-known biochemicals that are in the blood when people are moving into the excitatory system. The reality is, the more of the fiery cocktail you have in your system, the more likely you are to move into this, move across the upper threshold. In other words, you get a dose of cocktail and you may not be above threshold, but you certainly have some arousal going on. And you might call it the seed of the Hulk is activated. And then you get another dose, and you get another dose, and you get another dose, and now you're above threshold, and your body, because of that, is going to trigger reactive adaptations as mitigations. Why? Because that's the way we're designed to behave. If we don't get regulated back down into our range of tolerance within a relatively short period of time, then what's going to happen is that we move to the point where these chemicals are at such a level in our system that they actually begin to break down the body itself. And one of the first ways it does that is through an actual interference with the body's ability to process protein or synthesize protein. So let's go back a second. The fiery cocktail. We talked about, as you have doses, the more doses you have, the more likely you are going to move across the threshold. You can have a dose and not have any problem at all, but if you have multiple doses, you may move across the threshold. However, you can also have situations where you can have a great big situation happen and the dose is significant and move you across threshold as well. The problem really isn't the dosing. The problem is how long it takes a dose to metabolize. So as we go through this process, one of the things we realize is, of course, we're going to have reactive adaptations and mitigations because the body's trying to self-correct. But what most people don't realize is the length of time it takes the body to move from that dose point to where the body metabolizes that back down to, out of your system. And there's a huge range in humanity. A lot of the studies out there say somewhere between 8 and 30 hours to reduce a dose of this cocktail. So imagine what happens if you're, let's say a child, and you're getting a dose of cocktail and you're getting another dose. You get yelled at in the morning, you get scolded, you get shamed, you get to school, somebody gives you the evil eye look, or somebody says something to you that's hurtful. You're getting another dose, you get into class, you're somewhat aroused, the teacher gets after you, and the teacher gets after you again, and at some point you are way above threshold. And now you're going to react in some way. And you're going to react either in an adaptive way, which is overt, kind of aggressive, or you're going to react in the mitigating, which is going to do something to stop the pain or experience of it. The reality, though, is that if we're going to help people deal with this, we have to recognize that we may need to keep them from getting too many doses for long periods of time. And that is really problematic. It's difficult for schools to deal with this because the kid comes in the door, they may already be in a state of arousal. And then if the school is not designed to help calm kids down, but they put immediate demands on these kids, they just are adding another dose, and every dose makes it more difficult to get back down into the threshold range. People cannot be thinking in any other part of their brain other than that Hulk portion of the brain if they are above threshold. So this is really problematic. Let me give you an example, and this will break it out from event into doses, so it makes it easier for you to see. We've worked with a lot of veterans over the years, and particularly with a lot that have been involved in IUD kinds of problems where their vehicle was blown up. So let me use that as an example. You're in country, it's active, you're on patrol, and you're part of a 5-man, 6-man team, and you happen to be in the gunner area, and you're driving, you're already in somewhat of on edge because you're really paying attention to threat and risk, and your vehicle hits an IUD and blows up. Now, you're going to get a good sized dose for that. Would that make sense? You're going to get a real dose of this stuff. However, it's not a single dose. There's multiple doses. Because you're in the gunner position, you're the most likely one to be thrown out of this thing, and you're going to be stunned for a few seconds, depending on your own personal ability to recover. Let's say you're stunned for 12, 15 seconds. When you start to be able to hear again and sense again, one of the things you're probably going to notice is an overwhelming ringing in your ears, so much higher than you can tolerate, which in effect is a second dose. When your hearing kind of fades a little bit more, you may hear the screams and cries of pain from friends that are in the process of dying or seriously injured. That's another dose of cocktail. You get up because you want to help them, and you begin to move even though you're hurt, but you're able to move. And as you move towards them, you begin to take gunfire. Another dose of cocktail. As you reach the nearest person that's also been thrown from the vehicle, they're all chewed up by automatic arms fire right in front of you. Another dose of cocktail. And in your realization of your friend's death, you realize there is no safe place for you to be returning gunfire. That's another dose of cocktail. So it's not that you are blown up in the vehicle that is the only contributor here. There's multiple contributors to this, or multiple doses that are keeping your system aroused. And now your system is just really jacked up. It's very much over your range of tolerance. And it's going to be above your range of tolerance for a number of hours. As long as we have some time, and we can have that 8 to 30 hours to kind of get back into our range of tolerance, that's great. But what happens if, because you weren't hurt seriously, 20 hours go by and they want you to be out on patrol again with another team? Well, you're already above threshold, just walking in the door, so to speak. And this is kind of the problem we have when we start looking at behavior, particularly in children, because we don't see, nothing big, bad, and horrible is happening to them, but they are constantly in a state of arousal. Think about all the ways that can happen. Across tone, rolled eyed of a parent, the look, the tone of voice, the demand, or not getting a good night's sleep, or not feeling well rested, or maybe maybe I did something yesterday and I'm a little sore. And there's all these things that kind of contribute to that. And then the rush of the parent. We have to be gone by such and such a time, and we have to do this. How many of them are walking in the door already really close to threshold, if not above threshold, and then they get the new demands from the teacher with no ability to kind of regulate themselves, because children, particularly young children, don't have the ability to regulate well. They are totally dependent on the external environment to be the regulator. The way human beings are designed, we are at birth totally dependent on the environment to help us regulate. And as we mature, we become increasingly capable of regulating ourselves, as long as we have the ability to do that on occasion. So in an optimal environment where everything is bueno, everything is really good, then a child should be able to hit a place where they can self-regulate themselves, in other words, manage their own arousal, most of the time fairly successfully, and that should occur somewhere between 11 and 13. But if the child's early life wasn't optimal, we're going to push that back quite a bit, and maybe not be able to achieve it before they're out of their teens altogether. It is, and that's really uncomfortable for a lot of situations. We have teachers that did not want to go to school to become relationship experts. They wanted to teach science. However, if I can't calm this kid down, I'm not going to be able to teach science to him and probably a lot of other folks. If the same is true in the way we train quite a bit of time when we train foster parents for taking kids that have trauma histories. We don't help them understand that this is a biological process that is driven by changes in metabolism, and the reality is that when they're above threshold, they need a significant amount of time to get back into that window of tolerance, and where they want them to make that change right now. On more than one occasions, I've had parents say, well, the foster parents say to me that, well, the kid goes home for visits and then they come back and it takes them 2 days to calm down. And I say, well, remember when we talked about the metabolism of the body? They've been churned up all weekend, and now they're coming back to your house, and you think that they should just, snap into behavior that's there, but they can't, because their body is still processing through all of that stuff, and it can take them 30 hours. Now, another aspect of this is kind of important to understand. The more adversity, the more trauma events, the more negative experiences, the more challenge and demands that are placed on a person in their history, the more that they have hit arousal. The way the body responds is it actually responds at a lower change of if you want to, lower change of chemicals in the body. So let me give a liquid measure for this. So let's say that before, naturally I should have the ability to tolerate a whole cup of this cocktail before I'm above threshold. But because I've been above threshold so often, my range of tolerance is reduced. And now, if I get more than about 4 tablespoons, I am above threshold, and I'm there until I get back down. And that's really hard for people to kind of get a grasp on. So what happens to this child, that's a tablespoon, and this kid, it's, not even a half teaspoon. This kid has a half cup measure or a full cup measure, and this kid is that 3rd tablespoon, and they're blowing up. And people say, well, this kid's problematic because look at how they're behaving. Well, the question is, it's the wrong focus. Why aren't we paying attention to how sensitive this kid's system is? We need to design what we do for this person to help their environment not be issuing doses. That may require the teacher to teacher different. It might require a parent to parent different. It might require a therapist to therapize differently. Because if you can't take that into consideration, then what you're left with is blaming them for a reaction that is driven by a metabolic shift in the body. That's incredibly pejorative and destructive to self-worth and self-esteem. So you have an understanding. I'm only going to cover a couple of the ingredients, but I want to lay them out exactly what the problem is with them so that you can have a feel for what I'm talking about. Let me get some liquid here first. So let's just talk about 2 chemicals that are common in our cocktail. The first, cortisol. Every single human body on the face of the planet will change emotions, thinking, and behavior, and a lot of other functions within the body with a small change in cortisol. Now, again, it's going to be based on a number of things: your history of arousal and your particular tolerance to cortisol, which is unique for each individual. But as cortisol level increases in our system, its natural effect is, as this increases, it suppresses hippocampal activity. It suppresses executive functioning. It is affecting our ability to create memory that's sequential. It reduces our ability to reality check. It reduces our ability to have impulse control. So as it increases, those things are lost. So what is lost? The ability to be well connected in your brain, the ability to do all the executive functionings, thinking, planning, follow through, self-reflection, self-evaluation, living with any kind of integrity by some value system. The ability to manage our own impulses gets suppressed, so we're more impulsive. That's just a natural side effect, if you will, of having too much cortisol in your system.